Our friend and beloved colleague Jacob Soboroff joins us live alongside a group of fired CDC workers. Also joining me at the table, New York Times editorial board member, MSNBC political analyst Mara Gay's here, and distinguished political scholar, professor at Princeton University, MSNBC political analyst Eddie Glaude's here. But Jacob, you and your friends take it away.
Sure, Nicole, and I have to thank you because last time I was sitting with you right there at that very table, we talked about the roundtable that we did coming out of President Trump's joint address to Congress. We said we should do it again with fired federal workers. There are so many, we can't fit them all on one set who want to have their voices heard. You have kept your word, so I'm very grateful for that and for this real estate on your broadcast. I also want to say thank you to 11 Alive, our NBC News affiliate here in Atlanta, Georgia, where, of course, the CDC is headquartered. They have graciously opened their studios to us. Let me introduce you to who I am here with now. Three very brave women who have decided to sit with us today to talk about the experience that they're going through. From left to right, I want to start with Sarah Boehm, who was fired from her role at the CDC as a senior communications specialist for the National Center for Environmental Health and the Agency for Toxic Substances and Disease Registry. In the middle is Abby Tai, who was fired from her role as a public health advisor for the CDC for the Drug-Free Communities branch of the agency. And on the right is Stephanie Tran, who was fired from her job as a presidential management fellow and a public health analyst at the Office of Readiness and Response. And Nicole started you guys this segment by talking about that a federal judge had issued an order. I actually have it right here, highlighted in yellow, says you guys are supposed to have gotten your jobs back by 1 o'clock today. Let me ask all of you, have any of you, I know you've been checking your email, have any of you been reinstated as of 5:06 on the East Coast?
No.
No.
Not a person. What are you hearing from your colleagues? Anybody else reinstated on a large scale at CDC?
At other agencies, but not at CDC.
Yeah.
Not yet at CDC. Abby, let me start with you. The program you work for, Drug-Free Communities branch of the CDC, I think it's important here to talk about what you did and what the consequences are of losing you from the federal government. The program worked to reduce overdose and substance use among young people. It's a joint venture with the White House. We hear constantly President Trump talk about how the greatest overdose crisis in American history is a priority for him. Was this expertise that you were providing somehow no longer relevant?
I would argue that no, it's very relevant. I served as a project officer in that role. I worked directly with local communities to provide support and guidance on substance use prevention for youth specifically. And my expertise actually is in rural health. And so I was working almost exclusively with frontier and rural communities out west.
I'm glad you brought that up because there were 700 different grantees all across the United States of America that you and your colleagues were interfacing with on a daily basis. What did they get from you and your expertise, your master of public health, that they couldn't get locally, that they needed the CDC for?
Well, one of the big problems, at least with some of the coalitions I worked with, is staffing shortages in general. It can be hard to find people with public health expertise in some of these rural communities. So I really served as someone who could come in and help them look through curriculum or through evidence-based materials related to substance use prevention and help them kind of figure out what would work best for their communities. I also was able to connect them with state and federal resources that they might not otherwise know how to connect to. So I served as both almost like a subject matter expert in substance use prevention, but also as a connector.
For the first time in nearly a decade, and I've covered this issue for us on MSNBC and NBC News, overdoses in this country were on the decline. For the first time in nearly a decade, do you think that the work that you all were doing contributed to that?
Absolutely. I mean, most of these communities focused on alcohol, tobacco, and then whatever substance was kind of at large within their communities, which could be methamphetamines, could be fentanyl, could be opioids. They're all, DFC is really, Drug-Free Communities is really focused on community-based approaches, and we were meant to kind of help steward them through the evidence base and determine what works for their people.
I didn't say it off the top, but I do want to say I'm so sorry for what you all are going through. I can't imagine, and I think our viewers can't imagine, especially in a field of public health at such a critical time, you guys being terminated and being told, Stephanie, that it was for performance. Am I right?
Correct.
How was your performance review?
I scored a 4.0.
Out of 5?
Out of 5, yes.
So pretty dang good.
Yes.
You were doing policy management of the $750 million, which was being distributed over 5 years through your program, the Office of Readiness and Response. So you were dealing with, and your colleagues were dealing with, stuff like infectious diseases, natural disasters, biological, chemical, nuclear, radiological events. Who do all these local agencies call now, if you were the liaison, to get more information about how the federal government, the money the federal government is giving them, is supposed to be spent?
Right. So the Public Health Emergency Response Program is a collective of, I want to say, almost 100 plus employees. Few of the probationary employees being cut means there's less resources for them to be able to help. I mean, of course, they're going to be sending emails or calling, but the resources won't be there. And a lot of the folks who got cut at ORR are my age, and we're very young, new to federal government. And, you know, the goal was to kind of get us together and learn how to take the reins from the older folks.
You were a presidential management fellow. I talked to another guy, Jesus Murillo, after President Trump's speech. He was working for Housing and Urban Development. You guys literally are the best of the best. It's been a program that's been in existence since Jimmy Carter was the president of the United States. You must have had, like so many PMFs, big dreams about what you wanted to do in the federal government.
Yep. I'm still in shock that, you know, based on everything I've done, you know, 2 degrees in 7 years, I became a PMF, beat out 11,000 applicants. And in my year, 2023, there's about 200 of us kind of in limbo right now.
One of the issues you were working on, because I really want to drive home how this expertise was being implemented. I'm from California. I covered the wildfires for us here at MSNBC and NBC News. You guys were actively engaged with the LA County Public Health Department. Some people might say, what does the LA County Public Health Department need the CDC for in the wake of a wildfire?
Yeah, so there's a lot of health that might become problem due to air quality. I know previous wildfires, we had helped them assist with getting, you know, air purifiers inside people's homes.
So really practical stuff.
Right, correct.
Sarah, let me get you in here because you were working for multiple parts of CDC, and you were a digital media specialist. You told me this story. It sounds like you were a good one. You had modernized systems to track important health issues. The government had been tracking, this is not a joke, you told me, using Microsoft Word before you got there and doing Google searches to track issues. You being laid off would suggest the work you were doing to modernize was done. Is that true?
No, I would say that's resoundingly false. There's not very many digital media strategists at CDC. I came in and saw a lot of opportunities for improvement, and that's not to say that those people were not doing good work and efficient work before, but my job was to come in and modernize our processes to reflect the digital landscape as it is now.
And so I want to make sure everybody understands this. You were one of the top performing folks there. You were nominated for a CDC Directors Award. The director of the CDC awards people like you for cross-center collaboration. And what you were awarded this for was trying to keep Americans safe during extreme heat events. And these are significant contributions towards successful responses to public health crises. Do you feel like today that work has been recognized? I mean, how does this firing make you feel about, you know, your earlier recognition from the agency?
I mean, first of all, the wording in my termination letter, which so many people got, was that I was underperforming, and I think that's been hammered home throughout the media. But I was performing so well that I was nominated for a pretty prestigious, important award. And my work, I was providing data and analysis to the Heat and Health team to measure the public health impact of some tools that we had released last year. Well,
in other words, I'm sorry to interrupt you, but in other words, potentially life-saving type interventions.
Correct.
Because we only have a limited amount of time, and I know Nicole wants to get in as well, you guys stay right here. But Nicole, as you can see, these are extraordinary, amazing, and I want to emphasize again, very brave women, because they don't know yet if they'll be reinstated. They very well might be if this judge actually is able to execute this order and if the Trump administration listens. But right now, they're all still in limbo.
I guess what I'd like to ask anyone that wants to volunteer to field this one is, what is their theory of why a political movement that describes one of its branches as MAHA, Making America Healthy Again, would eradicate the human beings in charge of keeping homes safe with an air purifier after a fire, protecting the youngest people in anyone's community, especially rural communities, from drug addiction, and making the CDC part of the conversation in the year 2025 about environmental protection. What is their theory of why they would get rid of all their jobs, all their functions?
We've been operating in complete radio silence. We have no idea how these decisions were made. There's no transparency. Our supervisors, in many cases, didn't even know that we were fired. So from the inside of the agency, there is really no rhyme or reason to these firings.
Sarah, if you were asked to... Sorry, go
ahead. Sorry, Nicole.
No, I was just going to follow up with Sarah. I mean, if you were asked to go back, how would you feel going back to your work?
I want to continue to do the good work. I want my job back. I felt like I was really making a difference for the American people. I do understand that it is an environment of chaos right now, so I think it would be difficult. But I do believe in the good work that we were doing, and I would like to continue doing it.